Okay, welcome and thank you for joining us for today's webinar, Navigating Linked Data for Australian Health and Social Research. Today's webinar is being presented by the Population Health Research Network, and my name is Erica Hageman, Coordinator Client Services at PHRN. But before I introduce the speakers, I'll just cover a few housekeeping topics. So all attendees are muted for the presentations. However, we do really encourage your comments and questions. So please use the Q&A on your screen. If you have a question, please type it in there and we'll pose it to the speakers at the relevant time. Time permitting, we will have an interactive poll later in the webinar for another opportunity to provide your thoughts and opinions. And we are recording this webinar, and once edited, we'll make it available to all registrants and also on our PHRN YouTube channel. But before commencing, I'd like to acknowledge the traditional custodians of the lands we are joining from today, and I pay my respects to the elders past and present, and extend that respect to Aboriginal and Torres Strait Islander peoples joining the webinar. In today's webinar, we're going to be hearing from representatives from the PHRN, the Australian Institute of Health and Welfare, and the Australian Bureau of Statistics. They'll provide you with an overview of their most relevant services and linked data assets. And there will also be insights from a recent national consultation, which was on researcher needs, and a preview of a tool being developed to help researchers choose the appropriate access pathway for their research project. And as mentioned, we hope to allow time for questions and comment. So at this point, I'm going to hand over to Professor Rebecca Glowett, Chief Executive of the PHRN.
Hi, everyone. Thanks, Erica. It's great to be here and great to see so many people online as well. We've had in the hundreds of registrants, and I can see that there's well over 100 online already, so that's brilliant. So my name's Beck. I'm the Chief Executive of the Population Health Research Network. The PHRN is funded by NCRIS, or the National Collaborative Research Infrastructure Scheme. So next slide, please, Erica. So we've been around since 2009. Recently, last year, celebrated our 15-year anniversary. And PHRN is the primary supporter of linked data research and infrastructure in Australia. So we work with all of the data linkage units across the country, as well as the AIHW. So our mission is to lead and enable the linking of data for world-class action-oriented research. We provide innovative infrastructure, as well as world-class research and analysis, secure research environments, advocacy, communications and training, and we actively encourage and are involved in multiple collaborations. So you can see this image of Australia here. We have our linkage units around the country that we support, as well as secure research environments. The national office for the PHRN is based in Western Australia, but we work all across the country. Next slide, please. So in terms of the PHRN infrastructure and services, we support routine linkage, specialised or ad hoc linkage, enduring linked data assets, some of which you'll hear about today, some national data linkage systems, some intergenerational linkage, so linkage of families, geocoding. We're supporting the National Master Linkage Key, if that comes about, hopefully. We have a metadata platform which has information on data which is linked or linkable, a large searchable publications database. We've created an online application system that people can use. We've created price calculators to help expedite the process of people trying to find out how much it's going to cost for their research and for the data to be linked or extracted. As I said previously, we support the secure research environments around the country, including SURE, the Secure Unified Research Environment at the Sachs Institute, and we also support governance frameworks. We support project facilitation, so we have a national network of technical officers and client services officers who work within the data linkage units across the country. We support community consultations and co-design, We also have expertise in legal, ethical and social implications. And we provide online researcher training and information. So today is really exciting for us. It's just about bringing people together who are interested in using linked data, or maybe who already do use linked data. This slide just shows some of the national initiatives that we are supporting. So the metadata platform, the online application system, the approvals for the National Mutual Acceptance Scheme, and the National Master Linkage Key, and the SURE Secure Unified Research Environment. So today we're going to be hearing from Caitlin and Rachel, who are going to be talking about the Hub and PLIDA, which are two of the largest national linked data assets that are used by researchers and government. Within those two assets, as well as the linkage units across the country, we support a number of different types of data, so not just health. So we support the linkage of registries, cohort studies, clinical trials, aged care data, disability, education, environment, police, justice, housing, and the list could probably go on. But really just to highlight that it's not only health data, but it's a lot of data sets that are useful for investigating health and well-being of the population. Next slide, please. So now I'm going to be passing over to Caitlin, who leads the National Health Data Hub. As I said previously, it's one of the most utilised national data assets, and one of the most valuable alongside PLIDA. So look forward to hearing from Caitlin, and please pop in any questions that you might have of Caitlin and Rachel throughout the chat, because we're really keen to hear from you as the community about what it is that you need to know, so that we can really help support you in your use of linked data. Thank you.
Thanks very much, Rebecca, and for the PHRN network for the opportunity to highlight the National Health Data Hub with your researchers and colleagues. Thanks very much for the kind introduction, but as mentioned, I'm the data custodian here at AIHW for the National Health Data Hub. Next slide, thanks. The pack's been designed for a bit of an information about the NHDH, so I can skip through a number of slides given that I have only 5 minutes. So I just again acknowledge our funding partners of PHRN and ARDC for supporting the funding and delivery of the National Health Data Hub. But next slide, thanks. So in terms of the session today, give a quick overview of the National Health Data Hub, its governance framework, and some emerging use cases of data. And then hopefully that will be able to help you guide which asset I think is to use when, as part of the foundational question that you have for today. So next slide, thanks. Keep going, sorry. So the National Health Data Hub is made up of a number of data sets compiled or integrated by across the Commonwealth and state and territory data sets. So we have data across a number of Commonwealth data sets, especially in the health space, including aged care and a number of things mentioned there, MBS, PBS, the usual candidates, National Deaths Index data and so forth. We also have state and territory data with regards to hospitals information, and that's for 6 of the 8 states, which unfortunately WA and NT not quite there yet, but are working towards getting that data in over the next 12 to 18 months, hopefully. So in terms of what's coming soon, we're engaging with a number of data custodians to expand the data offering in the National Health Data Hub. This includes information on mental health, perinatal information, and expanding to our welfare data sets nationally compiled here at AIHW, covering child protection, youth justice, housing and homelessness, and a number of other data sets there mentioned on the right. Next slide, thank you. So like all national integrated systems, they are developed on a set of guiding principles. These would be common to PLIDA, I'm sure, which Rachel will mention no doubt in her talk. But there are 4 key areas that the AIHW focuses on in terms of underpinning the principles for the development of the NHDH. In particular, privacy by design. So we work with data custodians to structure our data sets to reduce the re-identification of individuals and organisations within the integrated system. This privacy by design tries to find the balance of maximising the utility excuse me, of data in the National Health Data Hub, but also trying to prevent re-identification or spontaneous recognition within the system. We also have a policy around share once and use many times. So if you go to the next slide, thank you. We try to reduce the burden on all data custodians in supplying data to the AIHW. We compile nationally various different data collections here at AIHW based on state data. And so we are trying to ensure that the burden on data custodians are minimised so that they supply once and we can then reuse that across the national data integration system. So our legislation is quite unique that positions ourselves or our work in being able to on-supply data with the right approval arrangements and agreements in place. And so that has seen us share data for many things, including the ABS for the inclusion of PLIDA, jurisdictional linkage systems, and the National Disability Data Asset as well. But in terms of internally, the National Health Data Hub and the broader AIHW linkage system aims to deliver a number of key assets within that, including the child wellbeing data asset, the aged care data asset, and the COVID-19 register. Next slide, thank you. So next slide, thank you. You can keep going. This is an animated one, so yeah, that's perfect. Thank you. And so essentially there's governance arrangements for the National Health Data Hub that is outlined in the governance protocols of the NHDH, and that document is available on our website. That essentially outlines how the National Health Data Hub can be used and who can apply access to it. That document has been informed by our data custodians, those that are represented in our advisory committee and those through a federated membership, as well as the data custodian, its teams, and our ethics and privacy team. But importantly, the AIHW, as per its Act, can't disclose data to anyone without ethical approval. And so we have overarching ethical approval for the National Health Data Hub, and in particular, certain projects within that looks to add additional data via our NHDH plus N project model, and the information is available on our website with regards to that. And of course, the AIHW Act and Privacy Act regulates how the NHDH is delivered, and that comes through via our governance protocols, and that is explained in that document. Next slide, thanks. So I can sell you the benefits of the National Health Data Hub until I'm red in the face, but I am mindful that you have a full agenda this afternoon, so I will leave that slide for your own perusal. I will just mention that in 2025, our key focus was better coverage and expansion of data. Significant number of data sets have been added to the National Health Data Hub, including additional programs for some data sets. So the expansion of our aged care data, as well as the NDIS data that's come through in the last week or so, is just one of some of the initiatives that we've used to expand the data available to users upon request. The other element for 2026 focus is not necessarily expansion, although we do have a number of new data sets being added, but it is really about cadence. So a number of our collections that are in the National Health Data Hub are moving to twice a year or quarterly release schedule. Next slide, thank you. So in terms of promoting the use of the National Health Data Hub, these can typically be grouped into 3 main topics of generating insights of linked data. Quite often the themes are population insights, service impact and pathways. So within that, there's been a number of projects delivered around understanding particular populations with particular characteristics, such as those using health utility prior to the last year of life, family and domestic violence and suicide prevention. There's been a number of significant projects undertaken using linked data to identify cohorts of people where a registry may not be available. And this in particular has been used for dementia, as well as service impacts on hip fracture pathways and traumatic brain injury. And then, of course, the linked data is most commonly used to understand that health utility and health progression pathways, so such as hospital into aged care, cancer treatment pathways, and the entry into palliative care services. Next slide, thank you. So there are a number of emerging and future opportunities that we are beginning to explore for the National Health Data Hub. In particular, we are in frequent conversations around primary care, GP data and urgent care clinic information. There's also conversations with data custodians around ambulance data, and of course, communicable disease information. So not only transitioning the COVID register to the National Health Data Hub, but also supporting the work being undertaken as part of the design of the CDC in that space. I think that's it from me. If you go to the next slide, feel free to use that QR code for access to our website. There's a whole heap of information on there about the National Health Data Hub. But if you are interested in any more information, please feel free to reach out to us via nhdah@aihw.gov.au. Otherwise, yeah, that's probably it from me. Thank you. It's a bit of a whirlwind, but I was 5 minutes. I think we've hit that. So thanks, everyone.
Thanks so much, Caitlin. I can't see any questions in the Q&A as yet, but so if there are no burning immediate questions, I'll introduce Rachel Price. But yeah, feel free to even put in comments or any questions you have in that Q&A button. Yeah, thank you, Caitlin, for that overview of the NHDH. And Rachel from the Australian Bureau of Statistics will talk to us about the person-level integrated data asset, or PLIDA. Thank you.
Great, thanks, Erica. So, yeah, hi everyone. I'm Rachel Price. I'm the director of our data integration, partnerships and governance section. Contrary to your slide, Erica, I think that was an old role of mine in the DLC, and I take it you've probably taken that from LinkedIn, which shows some of the perils of using admin data. Yeah, in my current role as Director of Data Integration Partnerships and Governance, we support researchers to access the data that we hold in ABS integrated assets, including PLIDA, which I'll focus on today, as well as working with custodians across the data sharing landscape, Commonwealth, state and territory jurisdictions, and increasingly not-for-profits to help them to supply data to us, link it safely and make it available for research. So we'll just pop to the next slide and I'll get into the guts of the PLIDA Prezzo. So just to give you a bit of an overview, and you might already be familiar, but just as a bit of a primer, PLIDA is our person-level integrated data asset, and it brings together a really wide range of data sets from a number of different domains. So yeah, that includes health information, education info, government payment information, income, employment, population, demographics, as well as a number of ABS surveys and census collections as well. So there are a lot of similarities to the kind of principles that Caitlin's described. So yeah, the data is obviously held securely and carefully governed to ensure safe access. Yeah, the access is only made available to approved researchers for approved purposes, which is a big part of my role, supporting researchers to get that approval. I'll go into a bit more detail on PLIDA, what's in PLIDA and how it's used, but just to whip through a few things. So very widely used to answer policy questions, and increasingly being used to support program evaluation across government, as well as really widely used by the academic community for empirical research. Really important to emphasise is no identification of individuals in PLIDA. All of the data is completely de-identified and treated to reduce the risks of re-identification. And we're very cautious about ensuring that the data is only used for statistical and research purposes and not for any sort of compliance or regulatory uses. Under the in that middle box there, you can see the PLIDA partner agencies. You can see the list is starting to outgrow the box that we've got there, and it's not exhaustive as it's represented there either. But that's basically our sort of PLIDA board representation, and as our key kind of governing forum for PLIDA and advisory to the statistician who has accountability for the asset. So quite a number of agencies represented as part of that partnership. We might go to the next slide, and I'll jump into a bit of detail on what's in PLIDA. So hopefully you've got your magnifying glass with you, and you can make out some of these data sets. There's a lot of information online about what's available, but hopefully you get a bit of a sense here that there is a really rich wealth of information there, spread across a number of different domains. So yeah, as you can see, there's a lot of health data sets in those dark blue boxes on the left-hand side, quite a lot of ATO, income and taxation data sets in there as well, information about families and households, information about education and employment, lots of social support and disability information, and demographic information about migrants as well. And then there's a box there, sort of in not the lightest blue, but lightish blue, which is referring to our core modules, which are some derived data sets that the ABS produces to support researchers to more easily work with the many data sets that we have available in PLIDA. So just to help with consistent analysis of things like core demographics, location information, scoping if we want to look at a particular period of time, relationships between members in PLIDA, income, and there's a number of other ones under development at the moment, just to help researchers make kind of consistent or undertake consistent analysis, drawing on a large number of sources. So yeah, but most of the data that you can see here is available on request, subject to approval of the custodians, for researchers to access for their approved projects. A number of the data sets are linked for limited purposes or for sort of specific research cases. So we've got about 37, I think, that are available for general access, and about 84 that are on a more restricted basis. So there's quite a lot of information that's been linked over the years and is available for research. Might just go to the next slide. This bit of a techie slide, but like to include it in the preso just to give people a bit of a concept of how PLIDA is constructed. So we use the person linkage spine as the foundational piece of infrastructure to underpin the asset. So our spine is made up of the three sort of key data sets. So Medicare Consumer Directory, Domino, which is the Department of Social Services data set, Centrelink data set, and personal income tax data. And bringing all those data sets together, we attempt to represent an entity on the spine for every person who's been a resident of Australia since 2006. So at the moment, we've got about 39 million unique persons. Obviously, that's a lot higher than the current Australian population, but that just reflects that some people who might have been on the spine in 2006 may have left the country, or may have passed away, so they're not within the sort of the current population, and that's where those scoping modules become really important, to be able to look at the right sort of group of people at a particular point in time. The spine's updated every year, and we link all of those data sets that you saw in the previous slide to the spine individually, but in a way that allows them all to be sort of looked at together. I should mention as well that that PLIDA is also can be used in conjunction with our business level assets, so the business longitudinal analytical data environment, or BLADE, which makes it possible to do research such as looking at participants and providers, or patients and services, or and look at different interactions there. Might just go to the next slide just to give a quick example, a couple of examples of some of the health and social research using PLIDA. So with just a random selection here of some of the research that jumped out to me when I was trawling through our projects looking for some examples. But we have a register that we maintain on the ABS website where you can look at all the full list of projects that have been undertaken using PLIDA. We ask researchers to give us a kind of web-ready summary of their research so that we can put it online, and that's part of our transparency around the use of the data that's in PLIDA, and also a really useful resource for inspiration if you're thinking about what sort of things PLIDA might be able to be used for, or looking even to connect with other researchers who are interested in similar topics. That register is a great place to start to think about collaborating and developing research proposals. I'll just go to the next slide, please, Erica. So just a summary of sort of access to PLIDA and how we operate. So as you can sort of see here, there's and as I mentioned before, there's a large number of data sets that are available for researchers to request. They're the data sets that we consider to be part of the PLIDA modular product. So they're all available within our sort of management system for researchers to request access to. Each data set has its own approval arrangements, as we've agreed with the custodian, and a number of these require a justification as to why that data is necessary for the research question, which is passed on to the custodian to inform their approval decision. We also have those project-specific products. So as well as offering access to data that's already integrated, we do also provide a custom integration service where researchers can either bring their own data or have kind of brokered agreement to supply another data set, and we can bring that in, link it to PLIDA, and make it available alongside all of the other data that's already in there to support a specific research project. All of the access to PLIDA is facilitated via the ABS Data Lab, and I'll talk a little bit on a future slide about the access process. So we might just move on to that, and I'll come back a bit more there. But just to plug first, did want to mention that we are in the process of developing a PLIDA table builder product. So I'm not sure if anyone here has used ABS Table Builder for any other research. Census Table Builder is a really popular research tool. We are curating a version of PLIDA to make it available in Table Builder, which we're hoping is going to make the data more widely used, more accessible to a wider range of researchers, and at a lower price point than our Data Lab access fees, which I'll talk about in a second as well. Might just move to the next slide, please. Just to talk through the standard access process. So as I said, this is really what my team supports. So we work with researchers to develop a project proposal and make sure that it's sort of ticking all the boxes that we know our custodians will be looking at when they consider whether to approve the project. We do a review of the project proposal to ensure that it meets our sort of safe project conditions and determine what sort of approval arrangements will be required. We provide a quote to the researchers, noting that Data Lab access is charged on an annual fee basis, depending on the size of the project. And there's some links at the back of the pack to go to the website that has information on those costs. We then seek the relevant approvals from custodians. As I mentioned before, that can vary by data set, but as soon as the first data set is approved, that Data Lab project can be activated, and the researchers who have already undertaken safe people training and have been onboarded can get in and start doing some analysis. Once you've got access to the data, we fall into a bit of a supporting role. We're there to sort of manage the project over the life cycle. So if there's new data that you want to add to the project, we'll help you with that. Or new researchers coming on board, we sort of manage that process as well. And another team in the ABS supports the output requests, just ensuring that the data is sufficiently confidentialized before it's released and not likely to result in the identification of any individuals. So yeah, we basically support this process most of the way through, and yeah, details on how to contact us are in some of the future pages. So maybe just move to the next one now, Erica. Thank you. And yeah, this is just a rundown of some useful links. Nothing as fancy as the QR code, but hopefully enough of a jump off point for you to get some more information if that's stoked some interest for you.
Thank you so much, Rachel, and Caitlin and Rachel have very kindly agreed to that we can share these slides afterwards, so you'll be able to get the details from these slides as well. So it's a fantastic overview of both PLIDA and the NHDH, and I can see that quite a few questions have come through on the Q&A, and we'll perhaps have time to answer a couple of them now, and the others we might take on notice and then respond to, or we can, Rachel and Caitlin, if you have an opportunity to answer any of them online once Michelina is presenting. But I'll just ask the first question through an anonymous attendee. Has the introduction of the NHDH reduced wait times for the data linkage projects? Did you want to talk to this, Caitlin?
Sure, I can. I'm not sure in terms of the introduction of the NHDH what's the base in terms of what's being compared to as the question, but if anything, because the NHDH delivers modular-based products and pre-ethics approval has been obtained, then wait times which are observed should be shorter than a customised linkage project. I know in some cases that hasn't always been the case, and there are instances of that not being the case, but there are other instances where it's been very much reduced, and I suppose you've got the extremes of both bandwidth. So without knowing a qualifier of what's the comparator, I would say yes, reduced wait times have been observed.
Thank you. There's a question for both Caitlin and Rachel. Are there any family linkages in the NHDH or PLIDA? And if not, are any planned? So I guess to do that intergenerational linkage.
I can answer that if you'd like. The PLIDA, so linkage for PLIDA is on a person basis. So it's each individual person is represented as a single entity on the spine, and that's what we link to. However, there's been a lot of work done in the last couple of years to develop associations between those entities to understand relationships and relationships over time. And that's available as one of our core modules. So we have a core relationships module, which helps you look at family units, so the same group of people over a period of time and across different data sets. So it's not technically linked at the family level, but that information is available for analysis as a family or a household unit.
Thanks, Rachel. Perhaps we'll ask one more question. There's a few related to it, but I guess it's for both the NHDH and PLIDA. Is access to and release of data subject to ethics approval? I think this is ethics comes up in a few of the questions.
I can take that for the NHDH. So absolutely, ethics approval is required for the National Health Data Hub, but it depends. Whether you need to seek your own ethics approval is dependent on the project that you have. So we have overarching ethics approval for the NHDH, which covers a lot of use cases when people are using the National Health Data Hub, but it doesn't cover all. So you may find that given the type of data that you want access to, in particular hospitals data, then yes, additional HREC approvals required through the National Mutual Acceptance Scheme. But there are a number of use cases where additional ethics approval is not required because we've already obtained it for the system. But Rachel, you might want to answer it for the PLIDA.
Yeah, it's a slightly different situation for PLIDA. So we as PLIDA don't have a requirement for ethics approval, but we do represent the requirements for all of the different PLIDA custodians. So depending on the nature of the data that's being requested, an ethics approval may or may not be required. So yeah, there are certainly some data sets, and particularly in the health space, where that is a requirement, and we ask researchers to provide that, or we ask them to seek that prior to going to custodians to seek their approval. But there are a number of data sets that don't require ethics approval, and we don't impose that as a condition, as a global condition of access. It's maybe not quite the same as an ethics approval, but there's been a number of peers undertaken for PLIDA over the years that have considered the ethical use of the data and the privacy implications. So all the overarching use of PLIDA is I guess underpinned by those privacy impact assessments and the recommendations we've implemented as a result of those.
Fantastic. Thank you, Rachel and Caitlin. In the interest of time, as much as we'll get to the questions again later if time permits, but at the moment I would like to introduce my colleague, Nikolina Dombrovskaya, also from the National PHRN office, and she's just going to provide some information about a consultation we undertook on researcher needs, and also introduce a new decision support tool that we're developing to assist researchers in choosing the most appropriate data access pathway for their project.
Great, thanks, Erica. And thank you, Caitlin and Rachel, for introducing the National Health Data Hub and PLIDA and giving that great overview. As Erica mentioned, I'll give a little bit of a lead in to the National Linked Data Asset consultation that we previously conducted from the National Office, and then talk a little bit about the Data Access Pathways Explorer online tool that's currently under development. As everyone's probably aware, accessing cross-jurisdictional data is quite a complex undertaking, regardless of whether that data is sought through traditional bespoke cross-jurisdictional linkage or through a national linked data asset such as the National Health Data Hub or PLIDA. In late 2023 and 2024, The PHRN office led a national consultation to discover how we could help researchers navigate this increasingly complex and evolving landscape, particularly for research involving cross-jurisdictional data linkage. The consultation highlighted differences in the breadth and depth of the data available across a range of select data sources for cross-jurisdictional linked data projects, and I'll go into a little bit of that in a moment. And we do have the final report on our website if you're interested to know more about that. Next slide, please. So to give a brief overview, as part of this national consultation, we did quite a lot of research using publicly facing information that was available online at the time. We looked at the National Health Data Hub, PLIDA, and jurisdictional emergency department and hospital admissions data collections to identify what made these data sources distinct from one another, depending on where they were being accessed from. We spoke with subject matter experts, including data custodians, representatives from the AIHW, ABS, state government, and data linkage units. And there were many discussions held, many spreadsheets created. We then engaged with a consultancy to help us understand how researchers navigate these complex spaces when trying to access linked data. And a researcher or end user consultation was led by Future Friendly. And this aimed to better understand how researchers make decisions when presented with different options to access this linked cross-jurisdictional data. Next slide, please, Erica. So we know that researchers want to access the best data for their project in the most efficient way possible. And researchers may be willing to make trade-offs, but only if the non-negotiable project requirements are first met. The challenge is that researchers need to quickly access the impact of the pathway that they choose to access the linked data and understand the nuances inherent in the data depending on where it is sourced from. Side-by-side real-time comparisons of data sets or data sources would help researchers make an informed decision. Next slide, please. Thank you. So one of the recommendations from the national consultation was to create a digital dataset comparison tool, as Erica mentioned. This tool would allow researchers to compare options independently and at their convenience and assist with informed decision making. We're currently developing the Data Access Pathways Explorer with input from stakeholders who are involved in the national consultation that I spoke about earlier. So the first iteration of this Data Access Pathways Explorer online tool will be available to researchers in the coming months, hopefully sometime in mid-2026, and will feature key questions which, depending on how they're answered, will present the pathways that are available. Currently, the pathways under consideration in this first iteration of the Data Access Pathways Explorer include the National Health Data Hub, PLIDA, traditional bespoke cross-jurisdictional linkage via the PHRN, and linkage via a local state or territory data linkage unit. So we anticipate that the Data Access Pathways Explorer will continue to evolve in parallel with the data linkage landscape, and that it will be a dynamic and responsive tool to researchers' needs. Next slide, please. The Data Access Pathways Explorer incorporates some of the key insights taken from the national consultation. Using the findings from the consultation, we identified criteria that would help differentiate between key features of the data that might vary according to the pathway used to access the said data. This slide lists some of the criteria that researchers need to consider in answering their research question in order to find out which data access pathway options are available to them. So researchers need to have a clear research objective and, as mentioned, a well-defined research question to help identify project non-negotiables or essential criteria that must be met in order to effectively use the Data Access Pathways Explorer. So if you're not sure about what it is that you're looking for, it's probably not going to quite meet your needs. once you have a clear research objective, you'll then be able to explore data access pathways options based on different project needs, including access to data that addresses non-essential or nice to have project criteria versus non-negotiable project criteria. And I think it's important to have those distinctions in mind when using a tool like this. Next slide, please. Here you can see a prototype wireframe that we've been working on to give you a feel for what the Data Access Pathways Explorer might look like. The answers here are just for illustrative purposes, and they're not they don't necessarily represent what the available pathway options are, so please don't take this at face value. The first two columns contain the questions that relate to the criteria, which will help distinguish between different pathway options. And then the column to the right-hand side lists the current in-scope pathway options that I listed earlier, indicating which ones are viable or are not based on the user's responses to questions 1 to 9. There's also a window in the lower right-hand corner of the screen which lists the considerations that explain why criteria for a given pathway may not be met. And this should help highlight what criteria determines if a pathway option is or isn't viable. The tool is designed to be interactive, with pathway options updating in real time as the project criteria are answered or revised. And there are tooltips next to each question and an FAQ that will accompany the tool as well. There's also an orange bar below the pathway options that directs the researcher of who's best to contact to discuss the project. As with any tool, there are some caveats and limitations to consider. We see the Data Access Pathways Explorer as a first step in helping researchers determine which team in the first instance they should contact to discuss their project. So it's always a good idea to talk to a client services officer about the proposed project before embarking on what can be quite a long administrative journey. The Data Access Pathway Explorer is not designed to bypass important conversations with real people. Rather, we see it as a complementary tool to help researchers have a good place to start. There may be other project considerations which the tool cannot account for that will obviously have to be considered and discussed with the client services officer. We hope that for researchers, greater clarity and guidance upfront will mean better informed decision making and increased confidence in navigating the complexities of the data linkage landscape. Next slide, please, Erica. So I haven't had a look if there are any questions that were posted, but I think most of these questions relate to the previous talks. So unless there was anything, happy to leave that for now. Okay, let's skip over then to the next slide, please. Thank you. So we'd like to ask you a few follow-up questions about the topics that were covered in today's webinar. And your responses will help us gauge how the research community experiences the data linkage landscape, particularly when it comes to accessing data for large-scale national linked data projects. I'll shortly share my screen. I've already got some responses coming in, I think. So you can either scan the QR code or join via mobile, or you can use your computer to join. I think most people are quite tech savvy. I've got quite a few on there already. So I believe...
Yeah, Kate has
thank you.
posted the link in the Q&A, so you can also copy and paste that into your browser to access the Mentimeter.
That's great. Thank you, Kate. Okay, I'll shortly share my screen. I'll give everyone a minute just to have a go at this first set of questions. Okay. I mean, I think people are still joining, but I think it's kind of plateauing at an average of about midway. So we might move on to the next question. Were you aware of the various pathways for accessing linked data prior to this webinar? Okay, I'll give it 10 more seconds. Great, thanks everyone. And one last question. This is a free text question. So what else might help you choose the optimal pathway for your linked data research? Totally open-ended. Understanding costs, that's great. We did mention, I think Beck did mention earlier that we have the cost calculators that have been developed by the PHRN that do actually cover all the jurisdictions currently in terms of what the data linkage unit associated costs are for linked data projects. You can access the cost calculators either via the PHRN website or directly through whichever data linkage unit you're wanting to access data from. Easy access, I love it. Okay, we'll just give it one more minute. I am mindful we've got a little bit of time remaining. Yeah, see, cost and time comes up quite a bit. And while we would love to have time frames as a comparator at this point, we're just unable to do that as yet. But as we said, I mean, this is the first iteration of a tool that we hope will continue to evolve and provide some direction. Okay, might just leave it there. Thank you very much, everybody. I'll stop sharing.
Thanks so much, Michelina, and thank you everyone for your participation in that. And it's great to get people's feedback and assistance. And there will be, obviously, in the development of the tool, end users, researchers involved in the and doing user acceptance testing and actually co-designing this tool. I think in the interest of time, I'll just go to the next slide and pass over to you, Beck, to lead into our discussion of setting up a community of practice.
Right, thanks, Erica. So look, I think there's clear demand based on the number of people who were in this meeting and all of those comments that have just popped up on the screen around the desire for greater information around costs, timelines, data availability, pathways, etc. For us to create a community of practice for linked data researchers. Australia has some of the best linked data researchers in the world, and we are spread over a very large country. And there are challenges and barriers, and we know that. So I think it would be really valuable for us to create this community of practice for linked data researchers, really led by the researchers and users of linked data. So we would really like to hear from you about would you like to join a community practice? And what are the kinds of things that you would like to see discussed within that community of practice? The things that we would like to see and that we imagine that you might like are just information sharing, seminars, regular meetings, presentations and demonstrations like what we've done and seen today, training on linked data platforms, techniques, new and emerging tools. We know that there's a lot of new linked data assets, either existing or emerging. So we'd really like to hear from you about whether or not this is something that you would like and what you would like to see discussed, and how the PHRN can facilitate that. I think that we have a survey monkey that we would love you to very quickly answer. I think we're going to be sending you an email with a link to that survey for those who have already dropped off or are dropping off now. But basically, we're asking you would you like to join? Provide your email address and also some ideas about what types of things you would like to see us supporting through that community of practice. But also just like to take the opportunity to thank Caitlin, Rachel and Michelina for sharing really important and valuable information on some existing tools and linked data assets. I think there's clear demand from the community to know more, and the PHRN are here to support the community. So thanks very much.
Yes, thanks so much. Thanks everyone for attending. A special thank you to all the presenters. There's also in the Q&A a link to that Survey Monkey, but we'll also follow up this webinar with share the slides, responses to those Q&A that we couldn't get to today, and a recording of the webinar. So thank you everyone, and enjoy the rest of your day.
Thank you.